Talking about nurse practitioners.
And there's a bunch of different fields that nurse practitioners work in.
We're going to show you a few of them today in our video. I hope you enjoy.
I'm a nurse practitioner. I work in the emergency department at the Naval Medical Center, San Diego. My job in the emergency room is to see the patients and then order some tests like x-rays or lab work, and then look at the results of those tests and then diagnose the patient and give them medicine, or like if it's strep throat, give them some antibiotics, or if they broke their arm, then we cast them, or if they have a laceration, then I suture it up. So I love my job. It's a super fun job. I love the people I work with. I like the variety because it is the emergency room, so there's always funny stories because people do some pretty dumb stuff and then they end up in the emergency room. So those are fun stories. I like my coworkers. There's plenty of people running around and lots of activity, and I like helping people. So as a nurse practitioner, it's a great career. It's very versatile. And so a nurse practitioner is what we call a mid-level provider. So I'm above a nurse, but I'm below a doctor. So in other words, I can do what the doctors do in terms of seeing the patients, writing prescriptions, but I don't do surgery. And the nurses have to carry out the orders that I write. So to be a nurse practitioner, you have to already have been a nurse. And then you go back to school. And then once you finish nurse practitioner school and get your master's and now your doctorate, then you can go ahead and be a nurse practitioner. So it's a great career, and you might consider it.
I'm an orthopedic nurse practitioner. As a nurse practitioner, I do 5 steps while doing a physical examination with my patient. The first step I do is I take a look at my chart, and then I take the history of my patient, Jessica. How are you doing today?
Not good. My feet and heels are red and swollen. When I walk, they hurt and I have a limp.
Alright, so the third step I do is I do examination of the area that my patient has described to me. It looks like there's some inflammation there. It's very red. I take some tools just for general health. I'm just going to take your reflex. Alright, looks good. That looks good too. This is for sensory. You don't mind lifting up your foot. Tell me how that feels.
It tickles.
Tickles? Okay, good. This one?
It tickles too.
Okay, good. The first step I do is I diagnose you. I'm going to diagnose you with Sever's disease.
Am I gonna die?
No, you're all good. Okay, so the 5th thing I do is treatment. I'm going to prescribe you with these arch supports. You put them inside your shoes and you wear them every single day to help you heal.
Thank you.
You're welcome. So the job outlook for nurse practitioners is good, even though insurances are paying lower than they should for doctors and nurse practitioners. The overall pay for nurse practitioners is closer than it would be, so the future for nurse practitioners look good.
Hi, I'm a nurse practitioner and I work as a home delivery midwife. If you want to have a natural birth at home, you call me and I help you through it. No. Good. Not all nurse practitioners work at home or in a doctor's office. Some work at hospitals, and some work as missionaries in other countries. You doing good? Good. Now I have doctors on call if anything happens, okay? Keep breathing. Doctors and nurse practitioners aren't the same thing. While doctors go to med school, nurses go to nursing school. Doctors can perform major surgeries, but nurse practitioners can only perform small ones, such as stitches. Now, doctors also get higher pay, and they also get sued more than nurse practitioners. Okay, keep breathing. Get out!
Healthy girl, what are you going to name her?
I'll name her Cordelia.
I love what I do because birth is a miracle.
Hello, welcome to the Saharan Desert. I work as a missionary nurse practitioner here. Here is our trained lion hunting Rhodesian Ridgeback. There's a lion! Go, Salty! Sick him! Let me show you our makeshift hospital tent. Here we help the locals who cannot afford health care. We're helping people with AIDS. These two women suffer severely. Uh-oh. Hold on. Let me check her pulse. There is none. May she rest in peace. To become a nurse practitioner, you first need experience as a nurse. And then you do things that are called clinicals, which are sort of like internships. You follow around people in different fields and see what they do. When I followed around a missionary in Ethiopia, I knew that I wanted to help people in need, so I became one myself. Yep, she's still alive. We have minimal supplies, but we do have the basics. Here is water, gloves, and some local medicine that is supposedly really helpful. I do not get paid very much because of my humble stature, but if you worked up in a hospital with a very specific profession, you could get paid upwards of $100,000. I love being a missionary because it is so rewarding to help these people.
Hi, I'm a nurse practitioner who works in the field of pediatrics. Now, to become a nurse practitioner, you need your bachelor's, your master's, and then your PhD all in the science of nursing. Once you get through with school, you get your certification into your scope of practice, which is the field that you go into. Since I work in pediatrics, I can only treat people under the age of 18, and I cannot treat anyone older. Now, there's a lot of pros and cons that surround being a nurse practitioner as well. One of the major cons is the gross substances that you have to deal with,
including vomit, poop, and blood.
If you can't deal with these substances, don't become a nurse practitioner. Also, there's a lot of ignorance that can surround the job.
Are you a doctor?
No.
Are you a nurse?
I'm in between a nurse and a doctor. I'm a nurse practitioner.
I think my baby's very sick. She needs antibiotics right now.
It's just a virus.
No, she needs antibiotics right now.
No, she'll be fine.
Are you sure?
Yes.
You're a nurse practitioner right now.
She's gonna be fine.
Okay.
Anyway, one of the major cons is the very rewarding positive feeling that you get from helping people. Being a nurse practitioner is a very rewarding job. Being able to take care of people and help them all day. Also, you get very good pay and a lot of flexibility with the time and fields that you can go into.